Hi, I'm Dr. Sue. I work at 1044 Taraval Street and also 929 Clay Street in Chinatown as a pediatrician. So I see all kids ranging from newborn up to 18 years old. And I work Monday, Wednesday, Thursdays, but also by appointment at Chinatown. So as you can imagine, this past year has been a difficult one for many parents. Parents can attest to, their kids having difficulties with online learning. And it's been shown that, schools are important and they're fundamental for children and adolescents' development and their well-being. And providing this in-person academic instruction is important for their social and emotional skills. It also provides, the reliable nutrition at school. They have mental health services and opportunities for physical activity. I've noticed in this past year where a lot of kids didn't go to school, there's been a rise in mental health issues with depression and anxiety, isolation. A lot of children have had, worse eyesight just from being on the screens all the time. They've had poorer grades because it's harder to focus online in comparison to in the classroom. And then they just have had a harder time because they can't have interaction with their friends. And also I've noticed an increase in obesity because there's less physical activity and the nutrition is different too when they're always at home. Yeah, there's a few ways to do it. The most important way to prevent COVID-19 is to get the vaccine if you're over 12. Currently, that's what's recommended for all kids over 12 and adults. That's the best way to prevent COVID. And for those who are 2 years and older, they should wear a face mask also when they're indoors, and they should be at least 3 feet apart when they're in the classroom as much as possible to reduce the risk of transmission. And when they're outdoors, they should, or if they can't wear a mask, like when they're eating, they should try to maintain even more distance of 6 feet. And also when they're doing physical activities like sports or exercise or shouting or singing or in an orchestra or band, that's also important to maintain some more distance. Or if they're in like a common area, like a classroom lobby or an auditorium. And in addition to that, it's important to wear like hand wash. So that's just making sure when you wash your hands, you use soap and water for at least 20 seconds. You can sing a song like Happy Birthday, and that they should always either wash their hands when there's soap and water or use hand sanitizer with at least 60% alcohol if there's no area to wash their hands. And especially they should do this before eating, before touching their face, or after interacting with kids and like touching each other. Another important thing is screening tests. So if you are having symptoms of any kind of COVID, like runny nose, headache, cough, diarrhea, vomiting, loss of sense of smell, any of those, that you should get a screening test. So they offer many screening tests throughout San Francisco, throughout the city, that are free, and or you can ask your pediatrician to where you could potentially get tested. And then if you are having these symptoms, you should stay at home until you get the results for the COVID test back and you know that you don't have COVID. And then finally, just general well-being things like continue to eat well, be active, get enough sleep, and don't smoke. If people who do like e-cigarettes or any kind of smoking are also, not only is it bad for a teenager's brain, but it can also contribute to, potentially getting worse symptoms if you do get COVID.
加上疫情大流行，都唔使嚇到，第二場次民生產細集都係冇小衝圍走，社交距離要落正，記冇問題正，足唔記得戴口罩，溫度上面管正㗎，個人防護要勝在見中與腐敗依中。
Yeah, so the current CDC guidelines is that all individuals aged 2 years and older should wear a mask if they're not fully vaccinated. Even now, there's certain cities like Berkeley, San Francisco, who they're mandating, Alameda, they're mandating mask wearing, even if you are vaccinated. Currently, with the Delta variant being so contagious and circulating so much in this area and throughout the nation, they're requiring universal indoor mask wearing of all ages greater than 2 years old. So that includes students, staff, teachers, visitors, parents, regardless if you got vaccinated or not. Hand washing is key to preventing COVID-19. And I would say, like everything you mentioned, are important times to wash your hands. So after they've touched someone else, or if they're about to eat, especially, or if they've just, are going to rub their eyes or put their hands near their mouth or nose, you should wash your hands then. And also, in terms of how to wash your hands, I had mentioned this earlier, so it's important to use water, soap, and wash for at least 20 seconds. Yeah, so I think having extra face masks for if the face mask that they're wearing gets soiled, if it gets wet, then it might not be as effective. If it gets dirty, they have extra face masks in their bag. And then having hand sanitizer is good for when you can't wash your hands and you just need to put some Purell or hand sanitizer before you eat or do something. And then also, I think having disinfecting wipes can be good, especially for the little toddlers and the kids. They're always touching surfaces and it's hard for them to know not to touch it. So wiping down every surface helps to decrease the spread of viruses, including COVID. So this is a good question. Currently we know that the Western vaccine is very different from the Chinese vaccine. The Chinese vaccine is made from an inactivated killed coronavirus. So it's an inactivated vaccine versus in the US and some other Western shots, it's made with where they use mRNA and they target the spike protein that coats the surface of the coronavirus. And there are some countries that are currently conducting trials on mixed vaccines, including China, and they're trying to see if giving a different vaccine might be beneficial. Right now in the US, there's no current guidelines, CDC guidelines, or on whether all international students or people who come abroad from China or other countries should get the Pfizer or Moderna or Johnson & Johnson vaccine. This will be on a personal basis. So talking to your doctor and discussing individual needs would be appropriate in this situation. In the case of the case example that you brought up where someone came from China, they had the vaccines in China and now they came to the US and they got one of the Pfizer shots and then got a generalized rash. In that case, the CDC does have guidelines on if you have certain reactions on the first shot, including a severe allergic reaction or anaphylaxis where you have trouble breathing, a generalized rash everywhere, that you shouldn't get the second shot. So in that specific case, the girl shouldn't get a second shot, but this would be very much case dependent and something you should discuss with your doctor.